Oncology in Turkey. Cancer treatment is a common request from foreigners. People in Healthy Turkey Company face such requests multiple times a week. In this video, we will show how oncological diseases are treated in Turkish hospitals, what equipment these clinics are equipped with, what doctors work here and what methods they use, what level of service they offer to patients. Subscribe to the channel and ask questions in the comments. Here's everything about medicine in Turkey. Cancer is probably the scariest diagnosis for any person, and it's almost always a surprise, but not a sentence. Yes, cancer leaves little time for reflection. No time to choose where and with whom to be treated. Can't hesitate. Waiting in queues is unacceptable. Problem needs fast solution. But I also desire to delegate the treatment solely to experienced professionals of a high caliber, to individuals who employ effective and gentle techniques, to those who possess modern equipment and medications, to individuals whom you can depend on and have confidence in. Many individuals search for professional assistance in overseas clinics because they have confidence in the medical expertise, standard, and quality. So why Turkey? The International Cancer Research Agency uses the survival rate as an indicator to assess the effectiveness of treatment in different countries. This is the percentage of patients who have survived at least 5 years after being diagnosed with cancer. In Turkey, the survival rate for women with breast cancer is 78.6%. For patients with prostate cancer, the survival rate is 80.6%. Survival rate for stomach cancer is 17%. This figure is comparable to data in countries like Denmark and the UK. Meanwhile, medical procedure prices in Turkey are more affordable, though Turkish hospitals have comparable equipment and sometimes even surpass European ones in scale and level. Our channel has a playlist with videos about treating different types of cancer in Turkish hospitals. We regularly add new videos. Come and check for updates. And subscribe to the Healthy Turkey channel. Medical treatment in Turkey. Turkish hospitals that treat oncological diseases are usually very large hospitals. The clinic where we are shooting this video has 39 departments, chambers for 124 people. Of these, 33 are ICUs. Nearly 500 people work here. Of them, over 60 are doctors, 13 of whom have a professor's scientific degree. The equipment cost is hard to imagine. We display it in our video. The scale speaks for itself. Our hospital has all the most important departments, including departments of general oncology, hematology, bone marrow transplantation, pediatric oncology, plastic surgery, operations for complications, oncological orthopedic department. This hospital is one of the best in the Turkish medical system.
How many patients do you have from abroad? From which countries?
We accept patients here from approximately 80 countries. From Europe, a large number from Iraq, Palestine, Kazakhstan, Uzbekistan, many patients from Russia, Azerbaijan. Our circle of patients is very extensive. They trust us because we have highly qualified doctors and modern equipment at our disposal. Turkish clinics even have a concept called Oncological checkup. This is a complex of research and analysis that allows to diagnose cancer at the earliest stages, when the survival rate is from 90 to 100%. In large, well-equipped oncology centers, such advanced diagnostic methods as genetic testing, which detects inherited predisposition to gene mutations, scintigraphy, chromoscopy, autofluorescent and narrow-spectrum endoscopy, virtual colonoscopy, and isotope scanning of the body are used. One of the newest diagnostic methods is liquid biopsy. The patient's blood is tested for the presence of circulating tumor cells, cell-free DNA, or other oncological markers. Turkish oncologists apply international standards, the same ones used in leading clinics in the USA, Israel, Germany, and Switzerland. Many Turkish doctors are members of international oncology associations and regularly undergo internships in well-known American clinics, which allows them to learn and apply the latest achievements in the field of oncology and oncohematology in their work. We have a department of positron emission tomography, PET-CT, nuclear medicine. In recent times, there have been fresh advancements in the domain of PET and CT, and they are accessible to us. Professor Ayşegül Karge, oncology specialist. After graduating from Akdeniz Univ, she interned in the USA under Professor Phidias and at the Breast Cancer Center of Dana-Farber Institute. After returning to Turkey, he has worked at Memorial MedStar Clinic in Antalya for 13 Wabi hours MedStar in Antalya. Apart from the standard PET, we employ a groundbreaking innovation known as FabiPET, which is a completely new development in our field. FabiPET can offer a greater amount of detailed information regarding metastases and the early development of diseases. With its assistance, we can more precisely direct treatment based on the stage of the disease. We also have effective treatment methods in the field of nuclear medicine. For example, in prostate cancer, which often occurs in patients over 50 years old, in addition to conventional hormonal therapy and chemotherapy, molecular methods can be used. Lutetium treatment destroys metastases using beta rays, particularly in the bones of patients. But besides that, there are also new methods. One of them is actinium treatment. He seems more successful than lutetium, especially in prostate cancer. Generally, there are new developments, and we frequently apply them in our practice. We have an oncology council in our hospital. We assess the condition of patients together with surgeons, radiologists, pathologists, and most importantly, using very modern devices for targeted radiation therapy. We are assessing whether the patient should receive chemotherapy prior to surgery. We make decisions together in collaboration, and I believe that this is an exceedingly crucial factor in the accuracy of the diagnosis and the effectiveness of the treatment. Turkish clinics often use methods like removing tumors using the Da Vinci robot with manipulations unattainable for humans in terms of accuracy. Cancer cells are eliminated by a so-called nano-knife, which generates highly intense, narrowly directed electric fields. There are cyber legs and gamma legs for stereotoxic radiosurgery. Radiation therapy is performed on linear accelerators using rapid arc technology with pre-computer modeling of fields and modified intensity of radiation exposure. In oligometastatic diseases, i.e., for patients with a small number of metastases, ranging from 1 to 5, we prescribe local targeted treatment in addition to or instead of chemotherapy. What kind of treatment is this? There are procedures performed by interventional radiologists. This is the procedure of burning cancer cells, which we refer to as radiofrequency ablation. The freezing process, known as cryoablation. There exist alternative methods of treatment. For example, selective internal radiation therapy, SIRT. Microscopic spheres with a radioactive element are injected into the artery supplying the tumor. They destroy the tissue formation, but do not affect the healthy cells around it. Patients with tumors and metastases in the liver can undergo embolization, during which chemotherapeutic drugs are delivered to the liver through the artery. There are numerous local active treatment methods available, but in addition to these, there are molecular methods of nuclear medicine, such as treatment with actinium, lutetium, or radioactive iodine, which are utilized in the management of thyroid cancer. Turkish oncologists truly have a plethora of diverse medications for all instances of illnesses. To show at least a small part of the drugs, we were allowed to enter the pharmacy point of the hospital, where they sort and distribute drugs for general therapy. Is there a specific room where exceptionally powerful drugs and radioactive materials are prepared in anticipation of their use? Only hospital employees with special access are allowed to enter there. Traditional chemotherapy procedures are carried out in a comfortable room, in a calm and friendly atmosphere, surrounded by paintings that are drawn by the patients themselves. Art therapy is an important factor in psychological assistance. Patients support each other, helping to cope with a common disaster. Such an atmosphere also improves the success of treatment, and patients can always rely on the help of staff. Doctors and nurses take turns here for several people at once. To choose a hospital that can truly provide the most appropriate medical care, it is important to know as much as possible about the specifics of different clinics, their capabilities, and how the local healthcare system works. Health does not forgive mistakes. Therefore, a special service company is responsible for organizing treatment for foreigners in Turkey. Her employees know the specifics of this field. They are real doctors with real work experience in hospitals.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
In this hospital, we noticed many foreign patients. Do you know what else I noticed in this hospital? Doctors here appear to be very kind and pleasant. They not only make an effort to ensure everything is comfortable for the patients, but they are also prepared to explain in detail what they are doing. Now I'm approaching the laboratory where patient tissue samples are being studied. This is a biochemical laboratory. All samples to be subjected to biochemical analysis and processing are sent to us. This is a blood analysis device. We possess a pair of Sysmex XN3000 modules. One of these modules operates with biological fluids, while the other module is responsible for counting the number of reticulocytes. This device is part of the Alinity series developed by Abbott. It is the most recent series released by the company. There are 3 modules here. One of them works as a biochemical device, and the other 2 work with hormones. With their help, we can get the results of the analysis very quickly. This is a device for determining blood coagulation, also from the manufacturer Sysmex. By utilizing the CS2500 series, we can efficiently and expeditiously achieve high-quality results. We conduct such tests on it as PT, APTT, D-dimer, and fibrinogen. Tests are carried out at this location, and the findings are utilized by our hematologist professors for both treatment prescription and progress monitoring. In this scenario, the specific examinations conducted are emification and protein electrophoresis. Not all hospitals possess the necessary equipment to conduct such tests, and we regularly perform them at this location. We can do electrophoresis of proteins, urine, and blood samples. In Turkish hospitals, ESP as in oncology ones, patients are kept in very comfortable conditions. Now we have been allowed to show one of the wards where patients lie down to recover from cancer. This is our ward. It possesses all the conveniences for patients. As you can see, the patient has the ability to watch television. He possesses a mini refrigerator. Here is a telephone call to summon a nurse and medical equipment that is prepared for any emergency circumstance. There is a kitchen where you can not only make tea or coffee, but also fulfill any of your everyday gastronomic needs and cravings. Located within the ward, there is a designated area where patients and their guests can unwind and interact in a serene and cozy environment without any delay. Private toilet with shower cabin and all necessary toiletries. This level of service greatly contributes to maintaining the emotional balance of patients and therefore plays a crucial role in the overall success of treatment and the approach to recovery. Turkish hospitals understand this well. Turkey is advantageously distinguished from other countries by a comprehensive approach to patient care. In other countries, you often have to pay separately for each manipulation. The company Healthy Turkey is responsible for organizing visits of medical tourists to Turkey through the all-inclusive system. They work only with verified specialists in both medicine and hospitality and coordinate all their work for each patient. Healthy Turkey takes all responsibilities upon itself, from consultations and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents. Contact for consultation at this phone number or through chat on the company's website, address on screen. There is a lot of information on other directions of health tourism. Don't forget to subscribe to our channel and don't miss new videos about medical tourism and assistance to foreign patients in Turkey.